How there? If you're watching this explainer today, chances are you or someone you love recently visited the doctor with a really stubborn, persistent cough, and you walked out with a very confusing, complex-looking piece of paper. Right at the top, it probably says something like GeneXpert, CBNAAT, or TB PCR. And look, let's be totally honest here. The second you stare at a dense medical report full of weird acronyms that look like a completely foreign language, it is so incredibly normal to feel a sudden wave of panic. We call that sudden anxiety gabrahat, and it's completely understandable. But I want you to just take a deep breath. Today, using some fantastic and clear guidance from Dr. Alok Kumar, we are going to decode this entire report together. It is entirely valid to feel confused and worried. I mean, you're holding paperwork that literally dictates your health, but it doesn't speak in plain English. So, okay, let's dive into this. For today, I want you to think of me as your supportive doctor sitting right across the desk from you. In this specific guide, ye jankari, as we say, we're going to break down every single part of that paperwork. No intimidating medical jargon, absolutely no panic, just a simple, direct conversation so you can understand exactly what your body is dealing with and, way more importantly, exactly how you are going to get better. Now, to really understand your report, it totally helps to know why your doctor ordered this specific fancy test in the first place. You see, back in the day, the standard go-to was something called a sputum smear test. You'd provide a sample of phlegm or balgam, and a lab tech would put it on a little glass slide to physically search for bacteria using a traditional microscope. But there was a really massive flaw in that system. If the bacterial count in your sputum was super low, those bacteria would literally be invisible to the human eye looking through that lens. The report would come back saying negative, but the patient was obviously still sick. Well, the GeneXpert test, it completely changes the game. CBNAAT, which, by the way, is just the technical medical name for GeneXpert, is honestly a modern marvel. It's a molecular test, so instead of thinking about it like a traditional microscope, I want you to picture a high-tech microscopic magnifying glass that's hooked up to a supercomputer. It doesn't even bother looking for the whole bacteria. Instead, it specifically scans your sample for TB DNA. Even if there is just a tiny microscopic needle in a haystack trace of bacteria left in your system, this PCR technique amplifies it. That means it copies that DNA millions of times over, so the machine cannot possibly miss it. And the best part? You get highly accurate results in literally just 2 hours, rather than waiting for days and days. All right, let's get practical. If you have your report handy, grab it. I want you to physically look at it with me right now. Visualize the layout of that page. Look near the center, or sometimes it's right up near the top, and find a bolded table box. It should be clearly labeled MTB Result. Got it? This is your very first crucial visual indicator. That one single line is the entire reason you had to take the test, and it's absolutely the very first thing your doctor's eyes will dart to. But what exactly is the machine looking for when it says MTB? Well, MTB simply stands for Mycobacterium tuberculosis. That's literally just the formal scientific name for the specific bacteria that causes TB. By defining it this simply, you know exactly what the GeneXpert machine was hunting for inside your sample. It wasn't looking for a common cold virus, and it wasn't looking for a standard chest infection. It was specifically scanning for the DNA of this exact bacteria. So, the crucial thing here is understanding what the results right next to MTB actually mean. Generally, it's going to say one of two things. If it says not detected, go ahead and take a massive breath of relief. It means absolutely no TB DNA was found, period. But if it says detected, well, that means the machine did find the bacteria. Right next to the word detected, you'll usually spot another word in brackets: trace, low, medium, or high. Now listen to me. Please don't let the word high cause you to panic. This is just a visual marker telling the doctor your bacterial load, or how much of the bacteria is currently hanging out in your system. Whether it says low or high, the factor means treatment is required, and that treatment is highly, highly effective. Okay, so what if your MTB status says detected? Once you've checked that, your eyes need to drop down to the very next line on the report. Just below your MTB status, there's a second, incredibly critical piece of the puzzle that the GeneXpert machine was testing for at the exact same time. This is the section where we look to figure out exactly how we are going to fight this specific bacteria. That line will usually say RIF Resistance. Now, RIF is just short for Rifampicin. Think of Rifampicin as our frontline soldier. It is one of the oldest, most common, and absolutely most powerful medicines we use to cure TB. This specific marker on your report tells your doctor a very vital secret about the bacteria living inside you. It essentially tells them, hey, Is our standard frontline soldier going to be strong enough to wipe this out? Or has the bacteria somehow built up an immunity or resistance to our best weapon? Let's compare the two possible outcomes you might see on this line. If your report says RIF Resistance Not Detected, this is actually fantastic news. It means the bacteria is weak against our standard medicines. The normal standard treatment plan is going to work perfectly for you. However, if it says RIF Resistance Detected, it just means the bacteria inside you is a bit more stubborn. It's essentially mutated to block that standard rifampicin medicine from working. When your report shows that RIF resistance is detected, medical professionals refer to this specific condition as MDR-TB, which stands for multi-drug resistant TB. Now, I know that sounds like a super heavy, incredibly intimidating medical term. Hearing that you have a resistant form of any disease can immediately bring all that deep anxiety rushing right back. But I need you to listen to me very, very carefully on this next point. Dr. Alok says it best, and I love this quote. Science बहुत आगे बढ़ चुकी है, घबराने की ज़रूरत नहीं है. Science has moved far ahead and there is absolutely no need to panic. If you have MDR-TB, it literally just means your doctor won't use that one standard medicine. That's it. Instead, we have special, incredibly strong, highly advanced medications that are specifically designed to completely bypass that resistance and cure you. You are absolutely still on the path to a full recovery. We're just taking a slightly different route to get there. But, and this is a massive but, whether you have standard TB or MDR-TB, there is one absolute golden rule you must follow. You must complete your full course of medicine. Never start, stop, or skip your medication without your doctor's direct orders. Why? Because missing doses is exactly how bacteria learn to survive. When you skip a day, you don't kill the bacteria, you just train them. You literally train them to become immune to the drugs, making them stronger and way harder to kill later. Every single pill is a step towards your cure. So let's make a plan. Set a daily alarm on your phone, keep your pill bottles right next to your toothbrush so you see them every morning, or ask a family member to be your daily accountability partner. We can wipe this out entirely. As we say, we can eradicate it, jad se mita sakte hain, from the root, but only if you stick to the plan. To wrap up, a quick guide for you and your family. Eating a high-protein diet will massively support your physical recovery, and sipping ginger tea can naturally help you manage any minor nausea from those strong pills. Family members, your biggest job right now is to provide that nutritional and emotional support every single day. Now, when you take this report to your doctor for your next visit, I want you to walk in there confidently and ask these 3 clear questions. First, ask exactly how long is my specific treatment plan going to take? Second, what minor side effects should I watch out for so I don't get spooked and stop taking my pills? And third, how can my family best support my nutrition during this recovery process? You now understand your GeneXpert report, you understand the enemy, and you know the path to victory. So are you ready to take control of your health? Talk to your doctor, follow the plan, and get well soon.